my name's Joseph, this is Cameron, and this is Alex, and we're presenting Scarhead. So I'm sure all of us have had some kind of injury or surgery before. Now, it usually heals on its own, but almost always it leaves behind some sort of scar tissue. According to Dr. Joe, physical therapist, PhD, scar tissue is very, very painful. And two of the most problematic types of scar tissues out there called keloid scarring and then adhesion scarring. Now, keloid scarring is the development of overgranulations of tissues, while adhesion scarring is the subcutaneous connections of two tissues that were not usually combined together.
According to Dr. Rossini, MD, 93% of all abdominal surgeries leads to this adhesion scarring. This is a big deal to her because it causes her patients a lot of pain and suffering. Dr. Joe, physical therapist, states that the biggest problem when breaking down these types of scar tissue is human error. He says that there's no way to pinpoint the exact location of the scar tissue, detect the density within it, or figure out how much force is required to break it down. This leads to a very prolonged healing process, very, very difficult mobility, and lots of pain. So, as Dr. Joe mentioned, our biggest problem is human error.
Now, how we envision Scarhead working is by a handheld tripod that's placed on the designated area of scar tissue. This tripod is going to relay an image to a monitor. Another way to think about how Scarhead will work is to think about an ultrasound machine. Now, the same tool that the ultrasound technician uses to place on the expected mother to see her expected child is the same kind of technology that we want to use at Scarhead. Now, this joystick is up there because on the relayed image on our monitor, we can use the joystick to move around the image to find scar tissues, and we can also use the joystick to adapt the intensity needed to break these tissues down. Now, Scarhead was designed to pinpoint and detect densities of scar tissue. And like I said earlier, another unique selling point of Scarhead is that it adapts the intensity needed to break down these tissues. For example, a 90-year-old patient is going to require much less force to break down tissues than, say, a 16-year-old patient would. If that 90-year-old patient receives too much pressure, it can do vital damage to tendons, nerves, and organs. Ultimately, Scarhead takes the guesswork out of locating scar tissues rather than the human eye. So with the ability to locate scar tissue, adapt the intensity needed to break down these tissues, and having complete control on the breakdown process, Scarhead is superior to anything on the market because it increases mobility, accelerates healing time, and ultimately takes the guesswork out of physical therapists today.
Now, physical therapy is a $35 billion industry that is expected to grow at a 7% annual growth rate until 2018. A couple of the factors driving the growth in this industry are the aging U.S. population, growth in employment, and low government regulations allowing for physical therapy to be more available. Now, with the average U.S. population life expectancy being 87 years old and government regulations being so low, this shows our industry will not die. In fact, the U.S. population has grown at a 1% annual growth rate every single year.
Speaking of growth, there are 33 physical therapy clinics in Evansville alone, the top 4 of which are Deaconess, St. Mary's, Pro Rehab, and Orthopedic Associates. Now, this is a very stratified industry. In fact, no competitor owns more than 5% of the entire market share. Actually, 45% of the market is owned by smaller, independently owned clinics. The largest U.S. publicly traded physical therapy company is named U.S. Physical Therapy, Inc. They average $282 million of sales each year, but this is less than 1% of our entire industry. Sounds like a great opportunity to me. Alex, will you introduce us to our competitive advantages?
Now, this chart behind us compares Scarhead to its 2 main competitors in the industry today. Deep tissue massages being pretty self-explanatory, and therapeutic ultrasound. Now, something to keep in mind with deep tissue massages is, yes, they do feel great, but you could walk out of that massage feeling worse than you did whenever you walked in. It all depends on your physical therapist on how they handle their massages. Now, therapeutic ultrasound is a similar product that uses ultrasound technology and heating elements in order to loosen up scar tissues. Now, something else to keep in mind when talking about these heating elements is that they can do damage to surrounding tendons, nerves, and organs that the heating elements weren't originally intended for. Now, these 2 products are great alternatives, but something to keep in mind is that they both still leave behind the scar tissue, where Scarhead is a one-stop shop by relieving pain by completely removing the scar tissue on the first time. Now, In terms of increasing mobility, efficiency, and accuracy, ScarHead is superior to both of these products because, like I said earlier, these two products, ultimately, they still leave behind the scar tissue, which in turn still leaves the scar tissue there, making patients less mobile than ScarHead would by eliminating it.
Now, for the active and aging U.S. population that require physical therapy needs, ScarHead accurately detects, penetrates, and breaks down scar tissue with the right amount of intensity. Now, unlike today's common competitors, ScarHead removes a human error aspect involved with physical therapy, in turn expediting the physical therapy process. We believe ScarHead should be common practice in all medical facilities. Thank you.